a lot of hope, really. There were good thoughts about how we can make the public healthcare system work better, and there was a lot of innovation in healthcare solutions from primary healthcare, secondary healthcare. So I think it was a good mix of ideas. There's a lot of innovation going on in the healthcare system. There's a lot to be sorted out in the public healthcare system, and there's just encouraging signs of progress.
I work as a GP in a rural environment, and what was really interesting was that this day was about localism, and we did hear about a lot of the solutions that are in place around the country, but I have to say we also heard a lot about the problems. So it's quite clear that the health system is still in a crisis, but it was heartening to hear Lester Levy speak about the role of primary care and the role of general practice, which it looks like it may increase under his commissionership. What we're not clear on is how the funding will follow this. The other thing I was really interested to hear about was the partnership with NIB and Ngāti Whātua, and that sounds like it's been very successful. And I'm also interested to know whether insurance companies would be looking at partnering more with primary care when services are devolved into primary care, because we're already doing a lot of the work that's done in secondary care, quite a lot of procedures with a greater cost efficiency and time efficiency. But that was a conversation that we weren't able to explore today, so perhaps that's for a later date.
I really enjoyed the variety of speakers. They came from different perspectives. And for me, localism is incredibly important. I work for the Western Bay of Plenty Primary Health Organisation, and we design our services intimately with our general practices, and we really appreciate localism in that design, because it's not until you start to implement something with clinicians, with our community, and listening to what they actually have to say, that you actually get that design right. So for me, bringing the funding right down to that community space, listening and learning is how we'll actually grow and change the system more productively and for our mokopuna in the future.
I think there was a real common theme around willingness to change within the sector, and the speakers were really great at providing quite a wide variety of views around the areas where change is most needed. I think the opportunity for us to look at the system as a whole system as opposed to parts of the system, secondary care, primary care, community care. So that opportunity for us as a collective is massive to actually make a real difference at a system level right across the board. There were so many great messages today, it's actually really hard to pick one, but I think Lester spoke about changing the things that need to change, and I think that's such a great place to start when there's so many things across the system that are popping up, and so actually really focusing in on actually what are those things we need to do now and what can we change now, as opposed to trying to, I guess, do things that are going to take us 3, 5, 10 years.
So it was a great day where there's a lot of people from lots of different aspects of healthcare, so insurance, ACC, frontline providers, GPs, interest groups, and I think getting together and discussing healthcare is incredibly important because there's solutions for everyone. So the take home is primary care is incredibly important, and we really need to improve primary care as probably the first thing to do to prevent the cost to secondary care. And then I think the other really important thing is that local solutions is really important. And when I mean that is do small things and complete them and look after patients locally. But at the same time, we need to have a central Health New Zealand that actually gives us policy on the way forward. So I think it's a combination of both, but getting the decision-making closer to the action, both in primary healthcare and secondary healthcare, is really important.
Well, I'd like to focus on what I talked about, which was we can't fix primary care unless we focus on continuity of care and using specialist GPs. Otherwise, we're only going to make worse problems for ourselves down the line. Localism is important in health, but at the moment, we simply don't have the IT structures to help support that. So we've got to fix the system issues first in order for us to be able to enact localism. We've still got a long way to go. And we've got all these different innovations, but unless you look at the core problem, again, talking about primary care, which is the need to protect continuity of care for patients, you're not going to make any differences, really.
What a wonderful day at this Health Innovation Summit. The main takeout for me was that localism and probably private combination to public and iwi/primary health is a solution. We need to collectivise. We need all to contribute. We can't just be looking at and blaming the government. The theme today, I think, was localism. It was actually reforms being tried. We're sick of reform. It's not going to happen. Localism, collectivism is probably where, particularly from an iwi perspective, where we have a GP clinic, we have primary care, we do live in the biggest city in New Zealand. We need to work together to ensure our people are healthy. I love the comment from one of the GPs that the patient should be at the centre of that. That was also doubled down by Professor Lester Levy said the same thing. The patient should be at the centre of all of our decisions.
Look, I really enjoyed the day, and I was particularly interested to hear Lester Levy talk about changes to the health system and localisation, empowering people closer to the patients to make decisions about their care. In particular, being able to fund services that may be provided by others. We're a remote patient monitoring company, and the monitoring is often provided by our partners like Hatapone St John or NIB. And being able to empower them to deliver what is required for their patients in the way they know is best for them, closer to home, will make a big difference to hospital capacity and workforce productivity.
It's an opportunity to take the best of both worlds. It's an opportunity to look at funding models and look at delivery models, do what is best in public and do what is best in private.
Well, today was about localism in health. It was awesome to hear from Lester Levy, who is going to be organizing an awful lot of health restructuring. I knew nothing about him coming in other than Avita. He was saying all of the things that I was hoping to hear from somebody who would be reorganizing health and thinking a lot about building up for more localist structures. So that was great. It's given me more confidence in what's to come. I know when the government was announcing that changes were going to be happening, everyone at our office was, not me. It would be a very challenging role. It's great that they've got the right person for it, it seems. So that was good. I also got to hear about some neat innovation that's helping out at the local level, including app-based approaches to GP consultation that's helping in securing access to general practitioner services at odder hours of the day and ensuring that people can find a GP when they need one. That's been great. We need to have more leveraging of technology because we've got an awful big problem ahead of us.
Yeah, look, we're obviously in a room full of like-minded people today. There's major challenges ahead of us in the healthcare industry, and I think for us there's an opportunity ahead with all the challenges that we've seen and the changes in the government for us to actually fix some fundamental issues and move forward to going back to basics. And you know, I saw some incredible speakers, inspirational speakers about how we can actually bring back care into local communities with localisation, and it's actually starting with that and going basics around how we can incrementally improve care in our local communities, and then looking at how that can actually scale across regions and nationally. And from my perspective as a tech provider, that's actually what we do all around the world. We connect healthcare systems, and we've done that in the South Island, and so we're quite ready for the challenge when Lester and the team is ready to look at the data and digital side.
I think the key message today is actually that the healthcare system in New Zealand is in need of reform. It is in dire straits, it is losing money, it is not working, it is too complicated. But the good thing is actually that there are solutions, and we heard the solutions too as well. So the solution has to be localism, that we actually trust the locals dealing with the challenges, that we trust patients, that we trust doctors, that we trust people who are dealing with these questions on a daily basis. And then we have to implement that bottom up. Because in the past we were often waiting for Wellington to tell us what to do. I think that time has passed. We have tested centralization to destruction, and now we actually need to trust the locals to actually fix that system.